And this is Ken Kraetzer for Sons of the American Legion Radio, a special edition of SAL Radio. We're going to talk with Congressman Phil Roe. Dr. Roe represents the 1st District, the Tri-Cities area of Tennessee, a veteran of the United States Army Medical Corps, and in 31 years medical practice delivered 5,000 babies. Dr. Roe, how are you today?
Doing great. Hope you're doing well and hope your family's doing well.
Oh, we're doing good. I mean, we're right in the middle of this COVID hotspot. We're right near New Rochelle. In fact, that's where our radio station, WVOX, is located. But what a great job by the doctors, nurses, healthcare staff, the Army who came in, the National Guard came into the area. What a job they've done in New York City. Must make you proud as being an Army veteran.
It does. And, one of the things that we'll talk about, in this discussion is how the VA has stepped up also and helped in the civilian side, really their 4th mission. And I want to give them a shout out for that.
Absolutely. Now, we heard from Secretary Wilkie. We were in Washington March 10th, actually, for the American Legion Washington Conference, and Secretary Robert Wilkie addressed the 1,000 American Legion leadership were there. And he talked at that time, a few days before really the changes started to happen, that there had been significant screenings implemented at VA facilities, taking temperatures and so on, other measures to screen those going in, employees, staff, and patients. How do you feel the VA was prepared for the coronavirus pandemic?
To back up, we remember that the World Health Organization in mid-January said that there was no known human-to-human transfer of this virus. That's not that long ago. And the reason that's important for our listeners and viewers is that the Middle Eastern respiratory syndrome, which is a very lethal, 35% mortality, is camel to human, animal to human, as opposed to human transfer. So once we found that out in mid-January, we had a joint bipartisan conference there at the Capitol Visitor Center with the CDC, the NIH, Homeland Security, Department of State, and HHS, the 29th of January. By then, the VA had begun to spring up and stand up their command center. And the VA has 3 missions and actually a 4th. It's not well known. Obviously, 3 known missions are VA cemeteries, disability benefits, and healthcare. But the 4th mission is to help in case of national emergencies. And they also have a national stockpile. They had several thousand ventilators, PPEs, and others. So they began to prepare. I think what they didn't anticipate, quite frankly, was the difficulty of getting these PPEs. And so they had to ration also. And we have a weekly call. Yesterday was our call with Dr. Stone, who's Undersecretary of Health, and Secretary Wilkie. We do that every week. We spend an hour on the phone each week with them.
And Dr. Roe, the VA struggled, as all healthcare providers have, with COVID cases, trying to find a way to treat people. There have been 9,600 cases of COVID-19 at VA facilities, about 700 deaths, of which some were civilians who were moved into VA facilities. How do you feel the VA was able to handle the COVID cases that they received and those they saw from veterans?
I think they were very well prepared. One of the things, and I'll go into that a little bit because it's created an issue here. It depended on where you were. Where you are in the Northeast, very hard hit. I have a lot of friends in the Northeast, physicians and other folks up there that I know, and I stay in weekly or even closer contact with, see how they're doing. If you look at where we are in rural Northeast Tennessee, we have a VA Mountain Home Medical Center. It's been open since 1903. It opened for Civil War veterans, and it's been open. It's a 5-star facility, great facility. Been on that campus literally hundreds of times. It meets the hospital where I practiced. I mean, the property is together. So there's a real good relationship between the two. We've only had 16 total positive cases, none of which have ever gotten in the hospital. And most of them are now convalescent. So where we are, it hasn't made much of an impact. There are only 300 plus cases of COVID positive in my entire congressional district. Now, what that has done, though, in places like that, our local hospital has over 2,000 beds total in their 21 hospital system, and they're only 33% occupied, which means there's a lot of medical care that's not occurring because of waiting for this epidemic to hit and having the hospital capacity. Our local VA medical center is the same. This Friday, the VA is going to come out with new guidance about how to begin to reopen. So that'll be another story that you probably want to cover by Friday. I know Dr. Stone said they'd be coming out with some guidance the last of this week about when and how. And I suspect we'll begin to open up sooner than, let's say, a New York is.
Well, good news today. One of the major shopping mall companies in the area just announced they're going to try to open up 7 or 8 shopping malls in the New York suburbs in mid-May. So that's a positive for us. One of the things I just wanted to ask you, because your medical background, ventilators were one of the keys. Governor Cuomo talked about it, needing those for patients going into New York City and New York State hospitals. It seems like it was a challenge. The success rate wasn't as high as people might like. How did ventilators help patients in this particular situation?
Well, it may be they didn't. One of the things we're learning about this virus, and we always do when we have an epidemic like this, an outbreak like this, is that how do you best treat these patients? And if you look in our state, and I bet you New York is no different, I think 80% of the COVID deaths were over 65 years of age in the state of Tennessee, and 90% were over 50. I haven't seen what the comorbid issues are with those, but younger people seem to do much better for some reason, as opposed to the Spanish flu 100 years ago, which they did not. So we're learning about this inflammatory response that goes on, and did the actual respirator, the tube down, actually make it worse? In some cases, it may have. So I think we've learned a lot about how to treat these people. We're also, remember remdesivir, the study came out on it that showed a significant reduction in the number of days a person was ill and the mortality rate. So hopefully we'll have newer and better treatments going forward, and we won't need mechanical ventilation as much.
And one of the areas are the staff members at hospitals, doctors, nurses, who have been taken on a COVID-19 virus. They've been infected, and the VA had 23 staff members die from this. We understand are the stats, and we've seen that in New York City hospitals, not just doctors and nurses. There were 3 at the Elmhurst Hospital that were just in charge of handing out protective masks, and they subsequently died. Well, tell us a little bit about the heroism of the staff members in the VA facilities, and what happened to them that caused their deaths.
Well, you know, it's what we do. I looked at the after 9/11. I remember I went back down. We weren't sure about how much, whether Saddam Hussein had a bioweapons, and whether smallpox would be one of them. I went down and got revaccinated for smallpox, because if we had an outbreak like that, where was I going to go? I was going to the hospital, take care of people. That's what I chose to do with my life. And I can't say enough about my colleagues. And it also tells you in this world what's essential. We found out that movie actors are really not essential. We closed the movie theaters. We found out that baseball stars, as much as I love baseball and basketball and football, wasn't essential. But who essential are the people who clean your room at the hospital, the people that cook the food, people that sterilize the instruments. I can't thank them enough, because I can't do my job without them doing their job very well. They're just as important as I am in the hospital. And not just doctors and nurses, it's the whole team. And I give a shout out to every person who went in every single day at their own peril to take care of their fellow citizens and people they didn't even know.
Absolutely, tremendous heroism demonstrated there by healthcare workers across the country. One of the areas that's been a real challenge and a scene of tragedies are nursing homes, both civilian and VA, and also the state facilities. We heard this week about facilities in Chester, PA, and also in Holyoke, Massachusetts, that had large numbers of veterans die in their facilities. Tell us a little bit about the challenge, what the VA has done to try to protect the residents of its assisted living facilities, and also help the state-run veterans homes that have really had some tragedies.
Well, we certainly have learned that, and matter of fact, just before this interview, I was on an interview with the AARP in the state of Tennessee about that, and I think it's with the nursing home facilities, whether they're state-run or privately run, whatever, are absolutely at high risk. And the VA was very proactive. As you mentioned, they would check your temperature, but they closed those, the CLCs to visitors very early, around the 1st of March. And I think they saved lives, no doubt about that. Very aggressive in how they did that. It also creates a problem, Ken, with isolation. I really feel badly when you see someone today in a hospital, maybe dying of something totally unrelated to COVID, but can't have anybody visit because of this. An elderly grandparent or parent that can't have their family, their grandchildren, their last days on this earth, and it's truly tragic. Or at a funeral where you can't go and share that with the family members. We're going to do better, and one of the COVID Cares For package, I think, will look hard at nursing homes. And again, a shout out to VA. On infected wise, they've had less than 0.7% of their employees affected. In Italy, I think their number is as high as 20% of employees, healthcare workers, became infected with COVID. So they've actually had a much lower, the VA has, infection rate of their workers than any sector I know of. And they also stepped up there in Massachusetts. To me, I think that's one of the most tragic things I have heard is the 70 veterans who died in that. I was just I didn't know one of them, but I was heartbroken for their families. I mean, these are mostly men who had served in World War II or Korea, some maybe Vietnam, that died this way. And we're going to get better at it. And we're going to have more testing, point of care testing, and more PPEs, and we'll be better prepared going forward.
And sir, talking a little bit about the military, how they've handled the cases they've seen, the fatalities are fairly low that I saw. It was less than it was a handful of, although there were more contractors who I saw had died of COVID serving the military. You have the instance of the nearly 1,000 cases on the USS Theodore Roosevelt that caused the ship to have to go into port in Guam. And now we have the USS Harry Truman sailing in the Atlantic. It's been out at sea since September on deployment, and it's a ready carrier to go out again. And they're concerned about bringing it back into port for it to be contaminated with COVID. We have West Point switched to online education, where we do a lot of reporting. What do you see about how the military is handling? What do they have to do to maintain readiness?
Well, one of the things that DOD has, the advantage they have, is they have young, healthy people. And, when I was that age, I felt like I was bulletproof. And turns out most of the fact these young people are. That was one of the things that they got lucky on. It's just not very lethal in young people. Occasionally someone passes, but not. I'll tell you where I got involved in this. The end of January, I get a call from our office, from a physician colleague in another community, and he said, my dad is on the Diamond Princess. And his dad happens to be a friend of mine who is a physician of general practice, a large practice in an adjoining county. I've known him for 30 years. He and his wife are on that cruise ship. I found out about that and called him up and started talking to him about the situation, and realized very quickly we had to evacuate that ship and to get those folks and get them into isolation, where you could isolate them, quarantine them, and then if they needed to have treatment, you could do that. We had, and I want to give someone a big shout out at HHS, Dr. Kadlec. Dr. Bob Kadlec is a former Delta Force doctor who now is at HHS and realized this. And I had a good conversation with him. That was on a Wednesday night. By Thursday, he sprung into action. By Saturday, all those folks were evacuated. Not a single one died who got off that ship. They got to proper care. And the average age of a passenger on that ship was 75. Not 25 like it would be on an aircraft carrier at the oldest 30. So the military, and I told them, I said, look, one of the things I've trained for, I was in the 2nd Infantry Division in Korea. We learned how to do that, take care of mass casualties. There's nobody better in the world than we are. So that's why the DOD, they train for it. They have young people, which was helpful here and that particular outbreak. But that's what they train to do, and they are very, very good at it.
Very good. And we do see the statistics for coronavirus here in the New York area starting to go down, but still high in places like New Jersey and growing in some parts of the country. And the Center for Disease Control released a report, or at least it was quoted, showing that the number of deaths nationally per day would go up going into June. What do you say? What is it going to really take to really contain this COVID-19 virus pandemic?
Well, I'm an old guy now, so I've got a little history behind me. I was a freshman medical student in 1968, and we had an H3N2 pandemic at that time that killed 100,000 people in the United States when the population of the country was 200 million. We didn't close anything down. We kept right on going, and I think the media has been really, if you think about it, we've got social media, Instagram, Twitter, internet, cable TV 24 hours a day. Back then we had newspapers, radio, and 3 news channels. That was it. The second thing that was going on in 1968 that sucked all the oxygen out of the room was the civil rights movement. I was about a mile away from where Martin Luther King was assassinated in 1968, March of 1968. That was a huge story around the country. And guess what else was going on? The Tet Offensive in Vietnam in 1968. So really, people didn't pay that much attention to an epidemic in the United States. It killed, it looks like it's going to be about the same number of people that die from this particular epidemic. So I think that has a lot to do with it. We don't know what the denominator is. In other words, we don't know how many people have actually been infected. So you really don't know what the death rate is until we do antibody testing on large numbers of people. And one of the recommendations I would do is to have the federal government pay for the test. And let's say, Ken, you and I go in to get our cholesterol checked, just run an antibody test at the same time, have the federal government pay for it. In a couple of months, you're going to know the prevalence very good in this whole country about how many people have actually been infected with the coronavirus. And that will tell you a lot about next fall. And it will show up again next fall. The virus is here. We're going to have to deal with it. I feel better about it. I think some places have dealt better than others. But a place like where you live in New York, I mean, that's been pretty tough.
Yes. And let me ask you, I did see Secretary Wilkie did a public service announcement the other night where he said that he was asking for retired doctors and nurses to come in to join the VA. I always encourage medical students, nurse students that I run into to consider the VA or try an internship there during their preparation. What's the situation with the VA overall in staffing and trying to encourage the young talented doctors and nurses to join the VA and serve there?
Well, that's a great question. It turns out that we gave the VA some authority to expedite hiring, and they've waived some of the rules they had during this. They've hired 10,000 people during this epidemic. So they have been on a real hiring spree. And one of the things I told them, I said to Secretary yesterday, I said, the reason you're lucky is that hospitals have laid a lot of nurses off. Our hospital system here with 15,000 employees have furloughed 1,300 people because of the empty beds. And I think the VA is actually benefiting from that. They're actually going out there and picking up these folks who want to make sure, because the VA hadn't laid off anybody. And it's a stable, it's a great place to work. I did some of my medical training in the VA. Most doctors do. About 75% of us are not do some or all of it. The other thing we did when we passed the Mission Act and the choice bill that we passed in 2014, we put 1,500 residency slots that were primary VA slots in primary care and mental health psychiatry, so that if you practice at you train at a place, you're likely to want to stay at that place and practice. So we've been doing this about 6 years now, encouraging young people to go there.
And I know the VA has been a leader in telehealth, video conferencing, medical checkups. I had one with my local doctor a couple of weeks ago, first time. I think this situation where people are hesitant to go into medical practices, but using telehealth, which the VA has been a big proponent of, has been helping. What's your thought on expanding telehealth?
Oh, there's no question. If there's anything good that's come out of this epidemic, it's been that. We were going to do it anyway. We're just figuring out how Medicare, HHS is going to fund it, and the private sector is going to fund it. There's no question that it's been beneficial. If I've seen patients, I saw patients for 30 years. Somebody I've seen for 25 years, I go to church with them, I know them very well. I could easily take care of most of what their needs are on the phone, on the telehealth. And then if I need to have them come in, I see them and say, hey, you're not looking so good, you can get them on in. I talk to my colleagues every day, and that's the one thing they are very happy about. And by the way, I visited VAs literally from Long Island to Los Angeles in the last few years as my role as chairman and now ranking member. And there are VAs now that use telehealth in their ICUs at night. If they don't have enough staff for 24/7 coverage, they'll have a doctor in say in Chicago or somewhere else that can provide all of that by telehealth, and it works fine.
Well, that's something. Hey, just want to ask you two quick questions about ongoing projects. One, we've been following the electronic health records project since Congressman John Hall was on your committee and doing hearings on it. It's gone through different iterations, but you have a contractor now, a $16 billion budget now on the project. How is that going, do you see?
Well, it got slowed up. Obviously, this kneecapped it a little bit, the coronavirus. But the other day, they had systems check and all checked out. It's one of the reasons I ran again. This is really down in the weeds, but it's probably one of the most important things the VA is doing. And think about this for a second. You get a 19, 20-year-old recruit that comes in, and I'm thinking about if we'd have had this during Vietnam. You come in as a recruit, 50 years goes by, and now you're 70 years old, and we found out there was a burn pit or an Agent Orange or something. Now when we have the electronic health record, we'll have a total lifetime record from the time you go in. You'll be able to take thousands of people, put certain parameters out, and learn an enormous amount of information. Yeah, this group of people that were in Afghanistan in this particular area had this. We need to compensate them for that. Or they were over there. No, they didn't have it. So we're rolling that out. It's supposed to be finished out by 2028. It is extremely important. DOD, as you know, is a little ahead. They started, and then the VA is in the Northeast now. And I visited in Spokane. I've been there 2 or 3 times. I've been out in Seattle, SeaTac out there and visited their facilities. And it's rolling out. It is extremely important to get this right and get it done. They got a little behind because of coronavirus. Clearly, I understood that. I mean, they needed to focus on the epidemic, but they're doing a good job with Cerner and rolling it out.
That's good. A final question for you. You were on the panel discussion at the American Legion Washington Conference led by Leo Shane last year, talking about how to address veteran suicide. As one of the speakers that day said, $6 billion has been spent but hasn't moved the needle. Secretary Wilkie talked about another major initiative starting this spring. What's your thoughts on trying to reduce veteran suicide?
Well, it's truly one of the tragedies that when you know that 20 either guardsmen, active duty, or veterans commit suicide each day. And I was sitting in my office talking to the staff 3 years ago in September. I remember it like it was yesterday. And I said, well, how much money did we spend on mental health at VA in 2003? And it was $2.5 billion. And I said, well, how much is in this year's budget? It was about $7.5 billion. I said, what's the suicide rate then? What's it now? It hadn't changed a bit. I said, so we got to do something different. So I think that we are looking at various things that work. I think we need to partner. There are people, look, we'll never solve the suicide problem at the 30,000 foot level in Washington, D.C. It's got to be solved at the ground level, at the VSO, at a Legion Hall, or at anywhere it may be locally. That's where it's going to be solved. No one knows the local community better. And the Prevents Task Force is what you're talking about. Dr. Van Dalen is in charge of that. And that was supposed to be finished by the 31st of March. But again, it got slowed up, its presentation, because of the coronavirus. But she spent a year. The president is very focused on that. Obviously, our committee is very focused on that. And it's the top priority of the chairman this year, which I applaud him for.
Well, Dr. Roe, we appreciate your time today. We understand you announced your retirement from Congress in January. Is there a highlight of your career of service in Washington that you really are proud of?
Oh, absolutely. I think the time I grew up in Clarksville, Tennessee, which is the home of the 101st Airborne Division. And I had an opportunity. My scoutmaster was a first sergeant in the 101st Airborne, and you could never do this now. And I can't get him in trouble because he's not here anymore. I went through basic training a half a dozen times at Fort Campbell as a 15-year-old. We crawled through pits and jumped off jump towers and did stuff you couldn't possibly do today. So I grew up essentially in the military, and the families, all of my family members have served in every war in this country's history. And so it's just part of our DNA. And I know I came in in Congress. I mean, I got out of the military at the end of Vietnam, and I served in Korea, not Vietnam. But I looked at how poorly our men and women were treated when they came home. And I said, we should never do that again. And so I had the privilege of being on the Veterans Affairs Committee. And I think the Mission Act, I think servicemen want to take great pride in that. The Forever GI Bill, I use the GI Bill personally. That is a huge thing for our students. And we know what the GI Bill did post World War II. It helped change the whole nation. And I think it can do it again. The appeals modernization. I guarantee you, Dr. Paul Lawrence has done more to prevent phone calls to my office than any person in Washington, D.C., because of his work on getting the appeals done in a reasonable manner. When I got there in 2009, there were 1 million backlog claims. I couldn't believe it. He says he's going to get, not the ones that have been appealed to the board in D.C., but just those claims in a timely fashion. He's going to get that number down maybe to 0 by July. That's amazing. So there have been a lot of good things we've done. There's a lot of work to do. When I leave the Congress in January, I'm going to volunteer to serve on the Dole Foundation board. She's asked me to do that, which it helps take care of disabled veterans. So I won't stop my veterans work when I leave the Congress.
Well, Congressman Phil Roe, Dr. Roe, representing the 1st District of Tennessee, veteran of the United States Army Medical Corps, ranking member on the House Veterans Affairs Committee, a past chairman of the committee. Thank you for your service to our country. My dad was a U.S. Army World War II and Korea era veteran. Would love to have met you. And thank you for your service. And really, on behalf of everybody, the 350,000 members of the Sons of the American Legion, 2 million veterans in the American Legion, thank you for your service. Really great to chat with you today.
Thanks for having me on.
Our pleasure. This is Ken Kraetzer for Sons of the American Legion Radio, WVOX in Westchester and White Plains, New York. Have a good day and stay safe.